Hello, everyone, and welcome back to Chapter 23, Lecture 1 mini-series here. We are moving through the parts of the upper respiratory system, which is the second part of this Lecture 1 mini-series. The first part, of course, was the basic introduction and the basic anatomy. Now we're just going to be stopping at each part along the way and breaking down its full anatomy. So we're really just stopping at each part and going through the respiratory system anatomy there. So we'll see how epithelial lining changes along the way, and we'll see what the airflow is through the respiratory system starting at the nose. So that's basically what we're looking through. We're going to be breaking down essentially the nasal cavity, the nasal region, going down to the pharynx, which is pretty brief, and then talking about the larynx here. So pretty straightforward. Let's get into this, and let's continue on and close out lecture number 1. These are the objectives for the second part here. And if you wanted to review the objectives from the first lecture, that's right up here. There's certainly some overlapping concepts, but really this is a little bit more specific and a little bit more specialized, where the first lecture was pretty general. So if you continue along here, you're just fine without even having heard the first part. Some minor overlap, but like I said, generally speaking, if you listen to this lecture without the first part, you're okay to keep going. All right, so let's get into the upper respiratory system, which is, of course, the second section of our Pearson book. We're following right along in chapter 23, part 2. So let's get into this. All right, so the upper respiratory system, air is first going to enter at something called the external nares or the nostrils. And you can see right down here, these are the external nares. Definitely should know that term, external nares. That's what I end up using on the exam here. And then posterior to the external nares brings us, well, I guess maybe superior to the external nares. That's going to bring us to the nasal vestibule. That's where you're going to have nose hairs. This, of course, functions to catch large particles, i.e. your nasal vestibule functions to filter air. And that's basically where you can put your finger. So the nasal vestibule is basically where your finger would go if you're picking your nose, and you're not going to go too much further back than the nasal vestibule. All right, know that this represents our first particle filtration system. So just inhaling, and this is why it's recommended that you breathe through your nose, is because you actually have a filtration system there, where the oral cavity, you're not going to have those sort of things. But of course, the oral cavity is stratified squamous, which does function in some protection as well. All right, the nasal cavity is going to open behind some of the flexible tissue of the nose, i.e. it's going to open behind it's going to be divided by the nasal septum, but of course, that's where we have some minor flexibility in the anterior portion of our nose, which is right here. This, of course, representing our hyaline cartilage. And then once we move to the posterior side, we're into the nasal cavity. So the nasal cavity is pretty far beyond where your finger would reach. But if you notice, we have some structures in there. And so we have structures known as the nasal conchae. All right, and these are projections that create something called meatuses. So the meatuses are these little channels that form because of these projections. And so you should be able to identify the actual meatuses as well as knowing what the projections are. I often ask, what is this lower projection here, or what is this structure? Because structures are projections or are actual physical things. And so you should know inferior nasal conchae, middle nasal conchae, and then, of course, superior. The point of these nasal conchae is to essentially create air swirling effect, and that's going to help increase the ability to filtrate, humidify, and warm the air, which we know is supposed to be part of the upper respiratory system. So here, this is where that humidifying, the warming, and the filtration of the air ends up occurring, is through these nasal conchae that end up creating, of course, the inferior, the middle, and the superior meatuses there. So be able to recognize both. I would say, what is this passageway versus what is this structure? Usually I'm labeling the structures because it's a lot easier to label and it's a lot more precise. So definitely structures here so far that you should be able to label and know what's going on there. Now, within the nasal cavity, we have something that is called the hard palate, and we can see this is the hard palate. So it forms the floor of the nasal cavity, but of course we are going to get into the digestive side, which from the digestive perspective, the hard palate forms the ceiling or the roof of the oral cavity. So two different perspectives to note. Certainly then that's correct. It's the floor of the nasal cavity, but it is the roof of the oral cavity, because this would be the oral cavity. This is the nasal cavity, and as you can see, it's the floor here, but it's the roof down there. All right, the superior portion of the nasal cavity, you should note, is the olfactory region, important for smell. So this is where all those olfactory little nerves would be poking through. they'd be right down in this region right here. And so that's the olfactory region for smell. You should definitely note that. Obviously, our nasal cavity houses olfactory receptors. All right, then we do have the soft palate behind the hard palate, and you can label it as the soft palate, or you can label it as, if you notice, I don't know, do they have it labeled here as the uvula? Here they only have it labeled as the soft palate. As we move on, this little part here forms the ball in the back of your throat. That little ball is known as the uvula. So usually when I label this, I give students some leeway to either accept soft palate or the uvula for there. All right, so behind the hard palate, border of the nasal pharynx, and so this is going to help form the nasal pharynx. And so the nasal pharynx, it'll begin at something called the choana, which is right back here. But if you notice on a previous image, it's also known as the internal nares. And usually I'm pretty good with allowing students to use either answer on my lab exams. But I would know both because on the lecture exam, I forget which one I used, and then sometimes I switch it back and forth. So definitely know choana, but also know it as the internal nares. All right, and then that brings us to the pharynx. The pharynx is probably one of the easiest organs to describe because it's literally a shared passageway of both food and air, and it extends from the choana all the way down to the larynx slash the esophagus. So we're going right into this region right here. This is the division point where the esophagus. So notice the esophagus is posterior to the trachea, and those are some common anatomical descriptions that I can use. But you should note that the pharynx begins pretty much right where the choana ends. It goes all the way down to this region where we have to make a decision. Do we go to the esophagus or do we go down towards the trachea? And in that region, when we have this area, that's going to be the laryngopharynx. Okay, so it's a shared pathway by both digestive and reproductive systems, but your nasopharynx, this one is individual. It's only pathway for air. So you should know the nasopharynx is the unique area that is strictly going to be for air passageway. And notice it's considered pseudostratified columnar epithelium. So notice I abbreviated this. If it is not clear that this is pseudostratified columnar epithelium, I would make sure you write that entire term out. All right, so the nasopharynx is pseudostratified columnar epithelium. And then once we drop down and we get into the oropharynx, which is back here, that's going to be the soft palate to the base of the tongue. So there to there. And you should know that that's going to be stratified squamous. So that's the stratified squamous that you should be aware of. And so the oropharynx is right here, again, stratified squamous. And then it ends at laryngopharynx, which we can see right down here. And that's going to be tongue basically to the esophagus. So going down here, base of the tongue to the esophagus. In that case, we still are dealing with stratified squamous. So notice your pharynx is mostly stratified squamous. The only time it's pseudostratified squamous is going to be in the nasopharynx where there's just air passage. So when it's food, you should know it's stratified squamous, and then the larynx, as we're going to see, is also covered in stratified squamous epithelium. So the only area here that's nasal that's going to be pseudostratified is going to be the nasopharynx and the nasal cavity. So this entire region up here, you should know is going to be pseudostratified columnar epithelium. So pseudostratified columnar is this region here. Stratified squamous is down there. So let's be crystal clear on that because, like I've said, for my students, I expect you to know these really, really well, and we're going to be testing on it throughout the rest of the semester. So get familiar with the types of epithelium. So that covers the main points of the nasal cavity. Certainly some other aspects that I didn't spend too much time pointing out. Like, I do still expect you to know that this is the pharyngeal tonsil right there. I expect you to know that that's the palatine tonsil right here still. And then we do have the lingual tonsil. So those are still fair game for me to label. In fact, I won't put tonsils on the lab exam related to histology, but these models have those. And so I do intend on labeling some of those structures. So that's your pharyngeal tonsil. This one tends to be the adenoids. And then you have your palatine tonsil. These are the ones that tend to get removed. And then your lingual tonsil is on your tongue. All right, so let's get into now the larynx. So we're just moving right along. We did our passageway from our essentially nostrils to our nasal cavity through the choana or internal nares throughout the pharynx, and then pharynx into now we're moving on to the larynx. And when we talk about the larynx is going to be the site where air travels immediately after the pharynx, But more importantly, you should note that the larynx is composed of a cartilaginous structure. So we can see all these little blue structures are cartilage, and they're going to surround what's called the glottis. Okay, and the glottis is a narrow opening to the trachea. We're going to see later on that this glottis, technically, the opening is called rima glottitis. But if you search glottis online, you're going to see that most people accept it as the opening or the space between the vocal folds. So we're just going to stick with this being the glottis, but technically it includes the vocal folds. But we're just going to stick with the colloquial use, which is knowing that the glottis is the actual narrow opening to the trachea. So we're going to keep it that simple. Don't worry about the word rima glottitis. We're just going to stick with glottis being the opening to the trachea. Now, when it comes to the trachea, we'll talk about that later, but of course the trachea is the windpipe. You should know that it's a windpipe. It's going to end up carrying air to the bronchi, which has approximately 16 to 20 branches, as I continue to stress. It's highly branched region. This bronchi just gets smaller and smaller upon each branch, and that's the main point of the bronchi to note. But again, we're still focused on the larynx. I just wanted to mention that the next stop is going to be the trachea. If you notice, the trachea does have tracheal cartilages. That's what keeps the trachea open, so it's really, really interesting. We'll talk about that importance a little bit later. All right, so let's continue focusing on the larynx. So the larynx, cartilaginous structure, it is going to consist of three really large unpaired cartilaginous structures that end up forming what we call the larynx. So if we look at these large ones here, we can see this large one, we can see this large one here, and then you can see that large epiglottis there. So we got a couple of unpaired cartilages to be aware of. The first one to definitely be able to recognize and identify. In the classroom, I have a model very similar to this. Very easy for me to label up most of these parts, and I'm going to talk about the main parts that I expect my students to be able to recognize. Those of you listening elsewhere, you definitely want to be familiar with what your instructor expects you to note here. All right, but the thyroid cartilage, you should definitely know hyaline cartilage, and you need to know that it forms the anterior and lateral wall of the larynx. So when I talk about anatomical description, that's exactly it. Identify the cartilage of the larynx that forms the anterior and lateral walls. That's the thyroid cartilage. Okay, I can also describe it as which of the following structures is commonly known as the Adam's apple. That's the thyroid cartilage. Yes, women have a thyroid cartilage, so therefore, yes, they have an Adam's apple. It's just more prominent on males. It just sticks out a bit on males, which is why it's called the Adam's apple, but that doesn't mean females lack it. It still exists as well. It's just usually not as prominent in females. The second one to note is the epiglottis, and notice this is elastic cartilage, all right? So it's an elastic cartilage projection upward. That is going to function to cover the glottis during swallowing. So this is what's going to direct food, that makes sure that food goes to the esophagus, which is posterior to the trachea, so that glottis just gets covered by the epiglottis, and that makes sure food does not go down the windpipe, which of course leads to coughing and of course choking. So epiglottis has a big role of directing food appropriately. And it is one of the three main cartilages that make up the larynx here. All right, the final cartilage is this inferior one, and you can see that it forms the posterior wall. So still hyaline cartilage, so notice you need to know what cartilages each of these three structures are. And that's going to form the inferior and posterior portion of the larynx, or the posterior wall, as I was just pointing out. So it is just inferior to the thyroid cartilage. So notice that's all anatomical descriptions. Fair game for me to ask which of the following structures exist just below the thyroid cartilage. Well, that would be the cricoid cartilage, as we can see right down here. And you can see that it forms the posterior wall. In fact, it gets larger as we kind of loop around. You can see the sideways angle here. It gets much, much larger as it loops around. So notice, it truly is the thyroid and cricoid cartilage being the main cartilages that provide the actual structural support and form the structure to protect the glottis. So it's just basically like a well, is the way I kind of think of this. This forms a well-like structure. All right, and then the epiglottis, of course, covers the hole in the well. Now, that doesn't finish the whole story. We do have two smaller cartilages to be aware of. We have the arytenoid cartilage, which is right down here. And then we have something called the corniculate cartilage that functions in the opening and closing of the glottis and helps with sound production. If you notice, we have something called vestibular ligament. If you look right there, the vestibular ligament is what attaches to the corniculate cartilages. Your vocal ligament, notice, attaches to the arytenoid cartilage. So vocal and vestibular ligaments reach out between the thyroid, the arytenoid, and corniculate cartilages. But if you want to be more specific, again, what I would do is make sure you point out that the arytenoid cartilage is where the vocal ligament attaches, and then notice we have the vestibular ligament attaching to the corniculate cartilages. And based on this sort of design, based on the image, you should note, and make sure this is clear as day, that the arytenoid cartilage is the main cartilage responsible for sound production. So you're going to need to write that on the notes because I know that these are both involved. As we can see the design here, they're showing you that we have vestibular ligament attached. When you look up corniculate cartilages, they certainly say that it provides some support. But the main one that's going to do the opening and closing of sound production, hands down, is the arytenoid cartilage, because you can see the vocal ligament is actually attached to it. So make sure you get that down. The arytenoid is the main one for sound production, and it's really the main one that's going to open close the glottis. So when we look at the next figure here, we can see there's something called vocal folds and vestibular folds, which is the same thing as saying vocal ligament and vestibular ligament. So be on the same page. The folds and the ligaments really are kind of saying the same things. The folds are a little bit more of a macroscopic perspective because the fold itself is going to include the type of epithelium that covers this, where when we talk about ligament, we really are talking about, bone to bone, or in this case, connection of cartilage to cartilage. So that's why it's a ligament. And then when you look at the fold, notice elastic ligaments in laryngeal epithelium. So the fold itself, I use them interchangeably, but the fold technically is including your epithelium on top of the ligament. And in this case, you should definitely know your vocal folds are going to be stratified squamous. The larynx, just think of the larynx as a whole as being stratified squamous. The vocal fold is going to be highly elastic, going to have elasticity. Of course, that's what allows for sound production. And again, lots of friction, so stratified squamous in the larynx in general. All right, so the vocal fold helps form the glottis, which again controls the opening, as we see. I'm not going to use the term rima glottitis, as you can see here. We're just going to call it the glottis. The glottis is this opening. All right, the elasticity, you should know, is important to allow sound production by pulling on these, of course, the vocal ligaments to allow vibrations back and forth that produce different sounds as we force air out of the trachea or out of the respiratory system as a whole. Okay, so sound is produced by muscles that reposition arytenoid cartilages related to the thyroid. And again, that's just talking about this point here. There's the arytenoid cartilage. There's the vocal ligament attaching to the thyroid cartilage. So that's all that's saying. I stressed earlier that you need to know the arytenoid cartilage is the one primarily responsible for that sound production. All right, so outside the arytenoid cartilages producing sound, it's important that you also know that we have something called vestibular folds that are on the lateral side here. Notice these are inelastic, so they're not going to have that vibration effect. And their function, again, is structural support. So they literally performing or providing a structure right down here that kind of closes off this region. And that allows us, of course, to have a small opening versus this really large one. So vestibular folds, just know they're lateral to the glottis, and they support the larynx and block particle entry, i.e., they're the larger supported structural support. And if you notice the vestibular folds, this is one of the things that I often ask on my lab exams, is which of the following structures is superior or inferiorly located. So you need to know that the vestibular fold is the superior structure, while the actual vocal folds are inferiorly located. In fact, we see that right here as well. So an important part of anatomical description is knowing its location. You should know your vestibular ligaments are technically superior to the vocal ligaments, which are slightly inferior, that we can see right here. And again, you see it in the image here. This is the vocal folds, which is inferior to the vestibular folds. Vocal folds are highly elastic. Vestibular folds are not. They're just serving as structural support. All right, so overall, this gets us through, of course, this brought us into the lower respiratory system. Remember, the larynx is part of the lower respiratory system, so keep that in mind. So we did start parts of the lower respiratory system. So again, this is singled out. So we got through the pharynx, which was a shared component. Once we get into the singled out area, which is the larynx, we are in the lower respiratory system. So this covered a portion of the lower respiratory system there. All right, so we are done. We've worked our way through, and we're just going to continue later on the second lecture to work through the We'll work our way through the trachea, talk about the lungs, talk about differences between the left versus right lung. So we're moving right along in our first lecture here. So lecture number 1 is technically complete right now. This completes the first lecture. We will be moving on, like I said, to the second lecture, which is mostly the same concept as part 2 here, where we just go and continue to move down the respiratory system as air flows through it and talk about the anatomy of each structure. So we're going to go to the trachea, to the bronchi, to the lungs, to bronchioles, eventually leading to the alveoli and the alveolar duct. So we'll be talking about those on the lecture number 2. So look out for that mini series coming up. I believe that'll also be a 2-part mini series. So lecture number 2, expect it broken up into 2 parts. And I'll see you at lecture number 2. Thank you all for continuing to follow along with us. We look forward to seeing you there. Take care, everyone. Have a great rest of your day.